In the realm of pediatric care, fevers are commonplace. Ibuprofen is a drug commonly sourced by parents and carers for its antipyretic properties. However, despite its wide availability, many people are still unsure how to administer it correctly. Kate, a babysitter, is one of these people. This is her story.
You join us as Kate arrives at the house of a frequent babysitting client, a boy named Tim. Tim's mother greets her in a slightly frenzied state.
Hi Kate, I'm running late as per usual. Tim has come home from school feeling unwell and a little cold. He's currently in bed with a mild headache.
At this point, Tim's mother shows Kate the medicine cabinet of the house.
Here's where we keep all the medicine in the house. If Tim wakes and his condition worsens, please don't hesitate to ring the doctor. I would appreciate not being contacted unless the doctor says his symptoms are the result of a more serious condition than a fever.
No worries, I think I can handle that. Enjoy your dinner.
Tim awakes and says he feels worse than what he did when he left school. He says he is feeling cold. He is shivering and sweating and complaining of feeling uncomfortable. Kate decides to take his temperature. Under the tongue, it reads about 38.5 degrees. Kate thinks this is a bit higher than normal and decides to ring the doctor.
Hi doctor, my name is Kate. I'm looking after a 9-year-old boy who weighs 36 kilos and is 143 centimeters tall. He's running a temperature of 38.5 Celsius under the tongue and is complaining of feeling cold and he's shivering a little bit. He's also sweating, he's not wanting to eat, but he's still drinking and going to the toilet normally.
It sounds like this young man is running a fever. Does he suffer from any allergies or other conditions? What's his family medical history?
Kate opens the folder containing vital medical information left by Tim's parents.
Tim was diagnosed with type 1 diabetes at the age of 5 and he manages it with regular insulin injections. He has no apparent allergies to any type of medication and there is no family history of allergic reactions to any meds. There is a family history of asthma, but Tim has showed no signs of suffering the condition himself. He is an active child with good attendance at school and plays a lot of sport.
Okay, Kate. I'm going to recommend that you find some ibuprofen in the house. Look for products such as Nurofen, Advil, or Dimetapp.
At this point, Kate puts the phone on loudspeaker and starts rummaging through the medicine cabinet. The doctor goes on giving what seems to be ibuprofen's life story.
Ibuprofen is a non-steroid anti-inflammatory drug that acts by non-selectively inhibiting enzymes cyclooxygenases 1 and 2. It has antipyretic, analgesic, and anti-inflammatory properties. Stopping the enzymes inhibits the synthesis of prostaglandins, which are factors in the body that help generate inflammation. So preventing prostaglandin production will decrease the inflammatory response to an infection.
The doctor continues. I think Kate has zoned out.
Ibuprofen is readily absorbed from the GI tract and metabolized by the liver. It has a half-life of approximately 2 hours and is excreted by the kidneys, with 95% of the administered dose excreted within 4 hours of ingestion. Ibuprofen is highly plasma protein bound. Ibuprofen commonly interacts with lithium, warfarin, oral hypoglycemics, antihypertensives, ACE inhibitors, B blockers, and diuretics. However, as Tim doesn't take any of these meds, these interactions are irrelevant. Any food he ingests will have little to no effect on bioavailability of ibuprofen.
Kate finds some medication that has ibuprofen on the label and comes back to the phone.
Okay, I found this bottle of Advil Children's Pain and Fever Relief Oral Suspension. I'm confused about which dosage to give because it says to give children between 7 and 10 years 10 mils, but Tim weighs 36 kilos and the bottle says to give 15 mils for children between 32 and 41 kilos.
Give Tim the dosage related to his weight. This is more accurate as the recommended dosage for ibuprofen in children is 5 to 10 milligrams per kilo of body weight every 6 hours.
Is there any possible side effects?
Unfortunately, the non-selective nature of ibuprofen can cause stress on the lining of the gastrointestinal tract and result in gastric pain, peptic ulcers, and vomiting. But this usually only occurs if the child has an allergy to the medication or is given too much ibuprofen. Even though you said Tim wasn't asthmatic, ibuprofen is safe to use on asthma sufferers. The maximum dose is 40 milligrams per kilo of body weight per day, so the Advil liquid should only be consumed a max of 3 to 4 times a day.
How long should he be on Advil for, just so I can leave a note for the parents?
Give it to Tim if he feels he is uncomfortable and wants his symptoms to be relieved. Although ibuprofen does help decrease body temperature, the main point of prescribing it is to allow the child to rest.
Okay, thanks so much for your help, doctor. See you later.
See ya!
Kate gives Tim the 15ml dose of Advil, and within 30 minutes he is asleep. She passes on all the information the doctor gave her, including dosing instructions, to Tim's parents when they get home. Tim's symptoms have cleared and he is back at school, but will not be participating in sport for the rest of the week.